we're going to do now is have Dave Basler, the Executive Director for the Ohio HBPA, is going to introduce the next group of panelists. Dave, again, is our Medication and Model Rules Committee Chairman for the National HBPA. And we're very happy once again to have this panel coming to the front.
All right. So we got that. All right.
Before we get started with this panel, I think I'd like to thank Eric and Lauren and Michelle. They've done a great job putting this conference together. I think all of the panels today have been informative, and I know this last one will be informative as well. So I think that they deserve a round of applause for everything they do to put these conferences together. It's not an easy task. So the title of the panel is the Kent Stirling Memorial Scientific Panel. And one thing I'm confident of is if Kent were still with us today, he would be very disappointed with racing's regulation of substances that are subject to environmental contamination. We've been too slow to develop thresholds or screening limits for those substances. He would be proud of the fact that the National HBPA is leading the charge to get those no effect thresholds. How do you do that? Time-consuming, labor-intensive research done by brilliant scientists, which lead to peer-reviewed papers, which lead to things potentially getting done. Some of those brilliant people are up here today, and they work tirelessly on the industry's behalf, and they're all doctors. In order, Doctors Finger, Tobin, Rooster, and Holland.
Thank you, Dave. I'm going to lead off, and I just want to give everybody an update. I'm going to start with our funding comes from, well, heck, it comes from wherever we can get it. If there's a call for proposals where I can get some money in, that's where it's coming from. But the meat of it comes from the affiliates. Every single one of you donates to either the Equine Health and Welfare Alliance program or Dr. Tobin's program directly. Our research publications are paid for by the funds that come into the Equine Health and Welfare Alliance. And I want to make sure that everybody doesn't slow down on that. The other place where we're able to get some money, and I don't know if Mike Tanner's here, he usually is, but not this year. So the United States Trotting Association. So our efforts are going in multiple different directions. So I just want to update you on, assuming I can make this work. How does this work?
I think it's the one on the right.
There we go. It worked. All right. So I'm going to start with, we all have concern about environmental substances. Our research, this has taken us down all kinds of crazy back roads and, behind hay bales. And our research is really, it's opened my eyes to where environmental contamination can come from. But positive tests can come from transfer to horses from people's hands, lip chains, bits, tongue ties, even in the water that they drink. So we tried for the longest time just to get, at first it was ARCI through the RMTC just to pick levels that seemed reasonable. We got absolutely no success doing that. And so we realized we're just going to have to buckle down and do research, do the research. We are researchers. So that's what we did. I'm going to first give everybody an update on the water study. Everybody should be aware that we have been collecting water at racetracks and testing it for pharmaceuticals. We got this, again, I'm beating the bushes trying to find money to do research projects. And we actually got some matching funding from the United States government, from the United States Geological Survey. At this moment, that funding has not been cut. With the cuts in Washington, we're fingers crossed, hoping that that doesn't happen. They were as interested. It's a win-win for the United States government and for the United States Geological Survey and for us, because we get to know what's in the water in the way of pharmaceuticals for our horses, and they get to have people collecting water for them. They don't have to send people out in order to test water quality all across the country. So it's a win-win. The research group is pretty much everyone sitting at the table, and Dr. George Mayland and the United States Geological Survey researchers, headed up by Dr. Smalling in the New Jersey office. So as of right now, we've had 36 kits that have been shipped to participants, of which 30 kits have been returned. Some of you who haven't returned your kits know who you are. Of those, we have 18 sites that have been completely analyzed. The sample locations include all of the locations shown here. We're still waiting on some additional testing, and I need to reach out to some of the additional jurisdictions like Texas and New Mexico, Oregon, Washington, to try to get additional buy-in. Only have a few standardbred locations, but we're just getting up to speed with the United States Trotting Association on this. What they've found so far, what they're willing to release, we don't have, it's going slowly, and they can't release all of the data. So even though we have had some samples that have been tested over a year ago, they're not able to share the results, or they're not willing to share the results because of it might interfere with publication. But the one thing that they can say is that the herbicide atrazine it's a broadleaf killer. It has been detected in almost all of the samples analyzed. There are a total of 18 pharmaceuticals that have been detected at least once, and metformin, of all things, has been detected at fairly high concentrations in 2 of the 18 samples. I'll tell you those 2 samples are in the same state. So we'd like to keep going on this study, and I'm going to urge people to either approve the funding and get the funding to us so that we can continue to sample as quickly as possible, because quite simply, I'm more worried probably than they are that they may end up losing their funding. So the sooner we can get the testing done, the better. We do have a parallel study that we're trying to get funding for, where we're actually testing horses at one of the high metformin locations and see what the relative risk is for metformin positives coming from the actual water, because it's at least 2 of the locations was pretty high. So the idea is, in addition to our other studies, to be able to pressure HISA and ARCI, because again, we have the USTA also involved in this, and potentially quarter horse jurisdictions, to pressure our regulators to identify no effect thresholds, and that just to identify the possibility that this does contribute. So that's something that a trainer cannot help. They cannot be the absolute insurer of the water supply. So briefly, our other research projects, the ones that we are publishing, the way that we develop the idea of a no effect threshold is we have to have a couple of important elements that go into our analysis. The first one is we got to pick a level that is unlikely to have an effect on the horse. Because if we don't do that, we're not going to get buy-in from our regulators. Once we conduct the studies, they've got to be published in peer-reviewed journals. And we have been doing that at Dr. Tobin's urging at a fairly good breakneck pace. And then the third element is just regulatory. Depending on the substance, it might be reasonable to have some kind of a penalty for environmental contamination to prevent people from actually attempting to titrate, because that's something that the regulators are always saying. So with that, I'm going to hand off to Dr. Tobin. To talk this one here, to talk about what it is that we've been doing.
The USTA has established a group of scientific advisors to review the scientific literature to make no-effect threshold recommendations. And the group is called the Harness Racing Medication Collaborative, and I have the honor of being a member, and so does Dr. Fenger. It's accepting no-effect thresholds submissions to review, and once they're accepted by the group, they're going to be sent to the ARCI Drug Testing Standards and Practices Committee as a model rules recommendation. And the National HBPA has also taken these scientific publications for submission to the FTC for rulemaking considerations for HISA. So basically what we're doing is we are identifying substances, we are conducting scientific research and literature review on them, and making a recommendation for what we will call effectively a no-effect threshold, a concentration that's pharmacologically irrelevant. The screening limits, which are the concentrations, the no-effect thresholds. There are a number of words in this area that are used that are to some extent equivalent. The screening limit is equivalent to a threshold, and we're discussing no-effect thresholds, no-effect screening limits. Now, metformin, the effective concentration in plasma, we calculated it at 6.9 micrograms per ml. So you divide that by 500 and you round it off, and we came up with a proposed screening limit of 5 nanograms in blood. That's the blood concentration. Gabapentin, we looked at it carefully. We reviewed the science, and we actually came up. I proposed to the Ohio authorities way back. I proposed a cutoff of 5 nanograms per ml in blood, and it turned out that Professor Sams had recommended 8, based on the same basically analysis. So the 8 went into place in Ohio, which is, I was actually pleased that I came in a whisker below their experts, so nobody could accuse me of being overly biased. Aminorex, we have a cutoff, 30 nanograms per ml in urine published. That's based on identifications in urine that were reported with no known source of Aminorex. And believe it or not, it turns out that Aminorex, if you have keep going, okay. Oh, you wanted me to switch right through? Okay.
Yeah.
My apologies. Metformin, let's do metformin first. We'll discuss it in some detail. The 4th most prescribed human medication. The dose to a human is 3 grams per day, and that's a pretty high dose. When you put a dose of phenylbutazone in a horse, which is a lot bigger, sometimes it gets up to 3 grams. So 3 grams per day in a human is quite a high dose. What's very unusual about metformin is it's excreted unchanged in the urine, and if you're on metformin, you'll take it 2 or 3 times a day. And when you go to the bathroom, the metformin that you put in a couple of hours before into your mouth is passed out into the urine and goes into the sewage system in the town and goes into streams all over the United States and all kinds of water places. The key element must be determined. We determined that the high daily dose for a human, the effective plasma concentration was 6.9 micrograms, which, as Dr. Fowler has pointed out on this slide, is 6,900 nanograms. And if you divide that by 500, you come up with a slightly higher figure than the cutoff we proposed, which was I believe 5 nanograms per ml. It's 1/1380th of an effective plasma concentration. That is, by any estimates whatsoever, a pharmacologically irrelevant no effect concentration. And we put that out in the scientific literature. And if you look at the bottom there, the fine print, you'll see that it's published. The first author is Dr. Brewer here beside me. Then we have a gentleman out of Dubai who reviews this materials for us. Then we have Dr. Lehner at Michigan State, who is an old colleague of mine and who has been a central player in getting these things published. George Balin in New York is an author and has reviewed and approved the publication. Dr. Holland is our colleague here also, and our good friend T. Tobin. And we found an access source to a German equine journal, and that's where they're all published. And they've been coming out one after another. Metformin was one of the first ones. Gabapentin was actually done a little earlier. It was being called in Ohio at up to 2 to 3 nanograms per ml in plasma. We looked at the thresholds, we looked at the cutoffs, and we figured that the effective plasma concentration was 12. So you divide 12,000 nanograms per ml is 12 billion picograms, and we calculated that 8 nanograms per ml was actually a lot less than 1/500th of the effective plasma concentration. And that actually, I believe, is on the records in Ohio. It's an in-house threshold. And we also published that in the refereed scientific literature. And the same team again below, Dr. Brewer, Dr. Dr. Jake Bashan was a student of mine, and we're all there, and the paper is published and it's out there. So anybody who calls a gabapentin positive has to be below this, or they have to defend their identification. Aminorex in urine, this came as quite a surprise, to tell you the truth. Aminorex was first identified as a metabolite of levamisole, and it was showing up in urine. And then when levamisole was made a prohibited substance, it still kept showing up in urine. And it turned out that it's associated with a certain group of plants that have a substance called barberin in them, which makes the plant unappetizing to horses and cattle. It's protective of the plant. And if it's in the hay, if it dries out, gets into the hay and the horse eats it, there will be aminorex in the urine. And we identified a concentration based on the concentrations in a group of samples in which there was no known source other than presumably a botanical source. Sorry, I should have switched forward. This is the Aminorex story. Okay, a treatment with levamisole, and again, the same authors. This one was published in the Irish Veterinary Journal. That was before we got onto the German journal approach. Methamphetamine. Methamphetamine is an amphetamine-related stimulant and is a recognized metabolite, I believe, of levamisole. Now, there is a very interesting aspect of methamphetamine that I just explained to some colleagues here, that if you're a methamphetamine abuser, or I prefer the word a recreational user, and you have it on your fingers and you're handling the horse, if you're handling the horse around the mouth, the probability of getting contamination into the oral cavity of the horse is large. What is forensically significant about this is that the drainage, the venous drainage from the mouth is into the jugular vein. And if you're pulling a jugular blood sample and detecting methamphetamine in blood, you're going to get an unusually high methamphetamine concentration based on the fact that it's coming from, basically it's transferred directly from the recreational user to the mouth, to the jugular vein, and then it gets diluted out in the horse, and you have a much lower concentration in the body system of the horse. The critical research that made that clear was done by Heather Knich in California, and we looked at her data and we did some calculations, and we calculated that an effective threshold, a guiding threshold would be, we've got it in there. It's do we have it in there? It would be less than 1 nanogram per ml. Actually, a little less than that. We rounded it up to 1. Would cover you for this kind of a circumstance. And again, we got it published, and it's published in, it was published in September, October last year with Dr. Brewer. Dr. Brewer is the lead author on all these papers, just so that it's not seen that certain other people are obviously pushing these activities. Benzylecgonine is quite interesting. Benzylecgonine goes way back to when we introduced ELISA testing, and it was discovered in the urine of horses in California at quite detectable concentrations. And the solution at that time, way back, was to take the human threshold. An airline pilot can fly with 100 nanograms of benzylecgonine in his urine because it's on the dollar bills in your pocket. It's an environmental substance, recreational substance, so it's out there, and everybody. Almost everybody in this room has had some level of exposure to a trace of benzylecgonine at some time. No matter how innocent and how far away you stay from these people, there's a risk. That's the way life is if you're handling dollar bills. We had 2 calls in Pennsylvania racing for benzylecgonine in plasma. The standard cutoff in place for 30 years was in urine. They called it in plasma, and I got reached out to by the folks in Pennsylvania, and I looked at some data. Fortunately, we published some data, and I looked at the data and came up with a good faith best estimate of the data of a 1 nanogram cutoff in blood. And I shared this as an expert opinion with the folks in Pennsylvania, and the 2 benzylecgonine identifications in Pennsylvania racing under HISA just quietly went away. There was no penalty, and we also submitted that for publication. Again, more or less the same team, and it's been published in January, February of 2025. It's supposed to be in press, but at least it's on its way. But we've already had the protective effect on racing in Pennsylvania. Now, this one, Pemeline, is extremely unusual. I doubt anybody in this room has heard much about Pemeline. 40 years ago, when it was available as a central nervous system stimulant, it was used for the treatment of certain conditions, and it was found to cause liver toxicity and was withdrawn from the market. About 2012, actually 2009, there was a case in England where a horse was being treated under a veterinarian's guidance with levamisole, and Pemeline was identified in the urine. And the British authorities took action against the trainer, and I had my chemists, I'm not a chemist, but I work closely with chemists, had my chemists look at it, and they said, Pemeline can be a metabolite of levamisole. So I sent an opinion. We sent an expert opinion off to the English, and they found they accepted the opinion that the Pemeline in this particular horse urine was associated with levamisole. So 2 or 3 or 4 more Pemelines came up, and I'm defending a horse person out of Canada. And I get calls from my colleagues, some chemists in Europe, and they say in Europe that Pemeline shows up post-race in the blood of horses in France, in Germany, and in South Africa. and it's at low concentrations, and they just don't call it. They regard it as a natural substance, and it's structurally quite closely related to Amidorex. So basically, I looked at some data we had done a long time ago, and we put together an analysis, and we said that 2 nanograms per ml should be the cutoff in blood. This was blood, and we shared that with the folks in Pennsylvania, and the HISA identification just quietly went away. And we also have that one. That one has actually published, I believe. Is that correct?
These-
2024.
These are all published, what you're going through.
Yeah. I haven't seen the published benzoectidine one yet, but they're all in press. Yeah. Synephrine. This one relates directly to some work with Dr. Brewer. Everybody in this room has synephrine in their body. It's in their platelets. It's a small molecule. It's found in bitter oranges, and it's believed to be involved in fat metabolism. And there have been clusters of positive tests in South Africa, Australia, and Mexico. And in fact, the first identifications were perhaps 10 or 15 years ago. I'd have to double check the literature for the date, but it was identified in Australian racing and was judged to be associated with hay. And they put in, and the next place that it showed up was in South Africa. And in South Africa, they had a cutoff that they had put into place because when the teff hay grew in certain seasons in South Africa, they saw synephrine in the urine samples. They had a cutoff. So I wrote this up as a case report, and I published a cutoff. I published the South African cutoff. I will not hesitate if there's an effective cutoff used for a substance anywhere in the world that has been accepted by regulators, and this was accepted by regulators apparently in Australia and certainly in South Africa. I put it into the literature and we got it out there, and that was published quite some time ago. Okay, 50 nanograms per ml was the cutoff in the South African racing, and it's out there now in the literature. And once we put it in the literature published, the chemists have to acknowledge its presence and has to acknowledge that it has been submitted, that it has been subjected to scientific review and accepted. And in this particular case, it's not alone scientific review, it's been accepted by regulators somewhere, so that strengthens the situation a lot. Thank you very much, ladies and gentlemen. My apologies for my not getting the slides quite as smoothly as I should have. Thank you.
So the list that he just went through are the lists that have been approved by the HRMC, the Harness Racing Group, for us to bring to the DTSP committee at ARCI for them to accept, hopefully. And then they've also been, I believe, submitted to the FTC by the National HBPA. And so as we get these published, we're trying to get them to both directions, both ARCI and also HISA, to get some acceptance of these thresholds.
I'm going to talk a little bit about some of the substances that have been identified by HIWU, and this will piggyback a little bit on the earlier presentation. So just a little bit about HIWU. They do not publish their thresholds, so it's really hard to know exactly what level they're testing at, which makes it very hard to understand what's going on. They also don't release their data to the ARCI, also making it very hard for us to know what is going on and what concentrations are being identified. They're not publishing or making common knowledge of what the concentrations are. When you read about these in racing news, it very rarely tells you what levels these substances are being identified at, which is very important. And another point that we've run across is we've had B samples be below what we think is the threshold, and having those be rejected by HIWU when those cases should be just thrown out when the B sample does that. I went through the HIWU portal last week and I counted up 68 different substances that have been identified by HIWU so far. And 75% of those are really just overages of therapeutic medications. Of the substances, 17 of those were considered banned by HIWU. So we've got about 25% of the total number of substances that are being identified by HIWU as considered banned. But as you'll see, that the majority of those are just inadvertent exposure or what we refer to as environmental contamination. So basically, the take-home point of this is we're not finding really doping. We're finding just overages of therapeutic medications for the most part. So I went again and I counted up every single one that I could on the HIWU portal. So we had 582 identifications that I counted last week. 493 of those were controlled substances. 89 were banned substances. So you'll get like 15% of the 582 identifications were banned substances. And again, those were mostly things that shouldn't be called because they were, for the most part, environmental contaminants. And just reflecting back in the earlier presentation, I didn't have, and I don't have the total number of tests that were done on racehorses, but the total number of tests that come back as a chemical identification are very small related to the number of horses tested. So just reiterating again, the majority of banned substances identified by HIWU have previously been identified by other racing jurisdictions in other parts of the world or places like the FEI or USEF as environmental contaminants. We haven't seen any new performance enhancing substances being identified by HIWU. And the banned substances are primarily dietary and environmental contamination. These are a list with the numbers in parentheses of what I counted up as the substances that they identified as banned. For the most part, we know that most of these are environmental substances. Some of these were from manufacturing impurities, like the tapenadol, which was in euthanol solution. Of note to that, when I was researching that for this presentation, that drug was previously identified in Australia, I think in 2019, when they had a cluster of horses with that. They very quickly in Australian racing realized that it was a contaminant and then just stopped calling those. I don't see any more of those in the Australian press. So those things are all known. Things like Effexor, like that's an antidepressant. It's very commonly used. It has, as far as I know, no performance enhancing effects. So a lot of these, in my opinion, should just have been thrown out. I looked pretty heavily on the FEI because I have a lot of experience with that. And they also have, you can go to their FEI tribunal and read all of their case reports, which is kind of fun for me. Most of theirs at the FEI level are what they're calling are also environmental contaminants. They do have an atypical finding policy in the FEI that allows the FEI to go through and look at the substance before they really take action against the responsible person. We're not seeing that with HIWU. The FEI has even made a special category called specified substances because they realize that those are things that are in the horse that are likely ingested and weren't given for the purpose of enhancing sport. So it's very well known in other horse sports that this is going on. So again, these are just a comparison of some of the banned substances that would not be a banned substance in FEI. This is a nice flow chart from Morgan Sports Law, the former employer of Liz Lazarus. that relates to the FEI, the former employer of Lisa Lazarus, that just shows that they have an actual flow chart of how to work through an environmental contaminant type situation that we are not doing with HIWU. HIWU is throwing the onus on the trainer or the covered person, and you have to explain your way out of it without really much help from HIWU. So these are some things that FEI would consider as a food substance, and they would give consideration to that. We've had these come up as banned substances with HIWU. A lot of the HIWU banned substances are human prescription medications that, because of HIPAA-related policies, you're not going to probably be able to ask your employees if they're taking any of these things. But very much so, an employee that is taking any of these things, that he's in the hay or handles your horse's mouth after taking their medications, could result in a positive. So we have to be very mindful of that human medications are very much a source of environmental contamination. So just, peeing in the hay is very much a very real problem, and it can lead to a chemical identification. Not being able to wash your hands after you use the toilet can be a problem as well. People that ship into a racetrack and having to use temporary employees, whether they're a hot walker or a groom or something like that, you might not know the history on that person. And we've had cases where a temporary employee has been the source of the chemical identification. Also, I don't have to preach to all of you that there are multiple people that are handling a horse on race day, which is fairly important. It's not just you or your one groom. There's numerous people that are going to encounter that horse leading up to the race. So our big two poster children of this problem would be metformin and methamphetamine. We've already seen a huge outcropping of methamphetamine cases that has resulted in significant penalties to trainers. We had 2 trainers that had their case dismissed just because there was no B sample. The rest right now are just kind of in a limbo pending the FTC's new rules. And we've had problems where we haven't been allowed to do a hair sample. So it is found, we have found human medications in ship installs. That is in one of our Horseman Journal articles where stalls were swabbed in Charlestown, and we found a whole host of human medications and recreational drugs in ship installs. I'm going to talk a little bit more in my next thing about preventative, but basically we all heard about hanging up signs. There's signs in the lobbies. Have your trainers get them right now, put them up. There's really no excuse not to do that at this point in time. And it's really important if you're going to have to defend yourself. Try to have a dedicated stall for medicating horses. If you can hand washing areas for your staff. The horsery app or cameras in your shed row is huge. If you can do that, that will be very, very, very helpful if you do have a case against you. I don't know if you can drug test your employees, but if you do get a human medication and you can test your employees and show them as a source, that's very helpful in defending yourself. Also documentation. So in summary of that, like HIWU has not uncovered any significant cheating. There hasn't been any real big, large sting operations. There's nothing going on like what's happening in the quarter horses. None of that has been uncovered at all since HIWU has started. So again, I'm here to say that we need scientifically based thresholds. They need to be made public. HIWU needs to stop focusing on inadvertent exposure and environmental contamination because it's a waste of money and it is ruining public perception of our sport. On to part 2. Is it going? Okay. So I'm going to talk to you from my perspective as a forensic toxicologist and also as someone who is a drug testing veterinarian for a long period of time on what I think would be helpful for trainers to do. You can take it with a grain of salt. Okay.
So one thing Dr. Brewer is going to bring up is some of this stuff's really helpful. So when she says the signs, they'll go look immediately. And if the hearing officer, who's usually just a judge, sees a sign, they go, why did they have that there? And allows for the discussion to occur about environmental. So those things are very, very helpful for your situation. That's why we're telling you that. We're telling you because what we're trying to do is give us the ammunition to help you.
And these are things that have helped people in past cases. So some of these things are known things that can be helpful. So before this happens to you, I would again, hang up signs in your barns, have signs about hand washing, using toilets, biosecurity, cleaning. If you can put up cameras, they will help you. We've had cases where the camera footage was reviewed to show that a trainer had cleaned the stall as well as they could, and that was factored into them not being fined. So if you can put up cameras, if definitely have some sort of documented employee training session and go through your tack room and make sure you don't have anything that would make HIWU go crazy. Whoops. If you're selected for drug testing, be very mindful and watchful. If you can't be there, if you can have a witness there to watch what the testers are doing. If they're not wearing gloves, take a picture of that, write that down. Make sure they're following all the documented procedures. If you can, I know it will be on the paperwork, but get the names of everyone that has handled your horse or contacted your horse. Document everything. Put it down in writing when it's happening. Like, go home and write down this happened, this happened, this happened, this happened, times, if you know the times. If there's any unusual circumstances around the blood or urine collection, such as the horse being a jerk and that being easy to stick, that's super important to us because that can help you if you know that things didn't go exactly smoothly. If you do get a chemical identification, it was gone over a little bit earlier today, make sure you retain a lawyer if you can. If you can retain an expert witness, that certainly goes a long way with HIWU. You can review our Horseman's Journals articles. We've been trying to put something helpful in there every issue. You can reach out to one of us for publications that we've written. We're trying to get them out as quickly as possible. And those peer-reviewed journal articles can help your case. Like I said, write a timeline of the events of that day. Make a list of everyone that was around the horse, what happened, especially if you are in a ship-in stall. If you are shipping in, I would be documenting everything like crazy because we know that ship-in stalls are a huge source of contamination. Take pictures of the stalls. Go to the HIWU portal and see if there's any other cases that, if it's a drug that you've never heard of. And if you can reach out to the other trainers that have had that or us, we'll help you with that. And also Google can be your friend. I love to Google. And that's where you can find out what happens in other countries, other racing jurisdictions, how these things are handled. That's very helpful. For your lab work, get your data. request that your B sample be submitted, get all of your lab documentation. HIWU likes to drag their feet on that, find out if it was in the blood or the urine or both. We need to know the concentrations of the substance and find out if it was the parent drug or the metabolite. And an important part that I've learned is when you're speaking to when you're in your HIWU hearing, the majority of the people there are not horse people. They don't know very basic things about horse care, racing, horsemanship. I had to explain like how a castration was done. That they had no idea. I mean, they don't know some things that you would assume that they would know. So I think it would be helpful to go at it with a very gentle educational approach. That's all I have. Thank you.
This one?
That one.
Okay, great. Thank you. So one thing that Dr. Brewer, I first want to thank Dr. Finger, Dr. Tobin, Dr. Brewer. One of the things we learned very early in the HIWU hearings is, there's not a lot of data. That could be used to your advantage or to your disadvantage, depending on where you're sitting. And so in this case, this group decided, look, we're going to have to start publicizing a bunch of articles very, very quickly because the peer-reviewed articles they are listening to, and I do hear them talk about that. So with that being said, continue to look for literature that can help you if you do get an inadvertent, irrelevant threshold is the way I like to put it. Okay? Because they're going to come into contact. I mean, Alex and I, we've talked about this and we've seen this in Kentucky and other places. And it's very, very important that you are helping and get some people that can support you and help you in your process. Because by the way, we really want to help. I come from it from an ex-racing official side. So Marty and Romans and everybody, they remember me running around being the other side of this whole thing, right? So I understand how hard it is on both sides for this, okay? So first of all, biosecurity starts as an infectious disease or medication. From our assessment as veterinarians, we look at it the same. So anywhere where the horse's mouth goes, think about that as a potential problem for you for environmental or irrelevant threshold levels to occur. So that could be the water buckets, that could be the corners of the stall. We're seeing many trainers now wearing gloves and or just being the ones giving the medication because they're too worried about a problem. I've had trainers ask me, if you're going to nebulize that horse, won't that nebulizer get into my horse? I said, I haven't seen that yet, but when it happens, I'll call you. So it's a question that people are starting to ask, but I do ask when they ask that question, how are you cleaning the nebulizer? And they went, oh, that's a good point. Because we do 5 horses right in a row, and that one only had the medication in it. And I was like, well, let's talk about how you clean your nebulizer. Let's go over that. And so those things are very, very helpful for the individuals that are sitting there. Because I'm going to tell you right now, it's hard enough to get an orangutan to the gate. And I know how that is, right? I was in a hearing with a methamphetamine where I too, like Dr. Brewer, had to describe how to put a tongue tie on. And the opposing side said, we would always wear gloves. I was like, great, go to the second race on Derby Day and watch them retie a tongue tie. And there are no gloves on any of us. Why? Because if you take a rubber glove and you pull that back and it snaps, it's all bets are off. The horse is like this, going around and around and around. Okay? The hearing judge wanted to know, how would you put a tongue tie on a horse? And he was all into it. So that helped the trainer. Because at times things can occur. Things that you're not, I believe, fully responsible for, even though you're holding to that standard, in my opinion. Okay. 2, if you're going to put a medication in a horse's mouth, think about wearing a glove or put it into a stall that will be the medication stall. And I know that's easier said than done, because in a given barn, if you switch a horse to a different stall and do something and leave them in there for 5 minutes, they're going to create hassles with the rest of the whole barn, right? So maybe think about doing it and figuring out a way if you've got to go outside or not in your grass area where every horse is eating, or at least in the wash area where you can wash it down the drain. Solution to pollution is dilution. The one Mepivacane study that Dr. Brewer helped with, they actually cleaned that stall 3 times and it still tripped the test. So, you know, having that video really helped them a bunch.
The video was them cleaning the stall.
Them cleaning the stall over and over and over again. I love that the racetracks are giving us porta-johns now. I've said that to many tracks. Until the one time that hurricane came up from Florida, by the way, and those things became flying targets around the backside of Keeneland. I actually heard one hit the side of the wall and I'm like, what is that? And that was a porta-john flying through the air. Okay. I didn't get the picture because security showed up and didn't want me to take a picture of it. It wasn't pretty, trust me. But think about this. Your grooms are trying to do the right thing and clean everything and do everything. But once they get done with that, how are they able to clean their hands? They're not. They're not able to clean their hands. So giving them an opportunity and then having a standard operating procedure for, look, we clean our hands, we clean our bathrooms, this is what we're doing. It's an interesting concept. I had a hearing officer that actually had an SOP from a barn that was pre-done, pre-dated, and sent back to their own email to indicate that that was the SOP because it dated it. And that was helpful, but they were trying. So an inadvertent threshold wouldn't occur. You can mail your own self. You don't have to mail it to your buddies. You can mail it to yourself and say, I'm doing this. Okay? So porta-johns are great, but you know what would be better? Lots of bathrooms that we can all clean our hands and really nice bathrooms on the backside. As a veterinarian, I would really appreciate that. Does that sound right, you all? Shake your heads up and down. All right. All right. Anywhere where the horse's mouth comes is in contact is a percentage risk. If a groom is peeing in the corner of the stall, there's no way around that, but clean that area. Also tell them, hey, look, let's not do this. Biosecurity and cleaning inadvertent trace spots are everyday thing. You're never going to get that over in one day. You have to do it every day, slowly but surely, and then everybody will come to help you do it. If you do go to a receiving barn, I have asked all of my trainers to send me pictures of the barn and the receiving stall before you walked in. And they do, and they're pretty bad sometimes. So that's helpful for me because then it documents if there's a potential problem. I'm not saying you have to keep it all the time. To the gentleman that did the get your data in 2 months or a month, you can erase the pictures if nothing is a problem. You don't have to keep them over and over and over again. Dump them. But at least you're setting a pattern of responsibility. So the key words I want you to think about, never say the word positive, say chemical identification. If you get a positive, don't say positive. They'll say positive all over every sheet of paper. You say chemical identification. 2, find out what's going on and start to document with yourself, your attorney, and your associates that are helping you. So this is what I love to see. I love to see horses having fun. The only problem that I see in all these pictures is there's no gloves on any of them. Even the jockeys don't have gloves on. But the one that scared me the most was the picture in the middle, because that was Breeders' Cup week. And everybody loves the horses and we all want that. And to your point, the data that you showed about showing a horse's eye is brilliant. We love it. This story got the biggest pickup out of the Breeders' Cup because it showed carrots being given to the horses before the race. And that's a pony horse, I'm sure of that. But at the same time, that's what you'd love to see. But as somebody that's worried about a chemical identification, it scares me to death because I don't know who's touched that carrot. And so Clara sent me a note saying, what do you think we should say about the pictures on the side of the carrots? And I was like, I hope there's not a problem. Remember that?
Yeah,
And we didn't have a problem, correct?
but it is only the pony horses, at least there, but
Yes, but it was the race horses before it. Okay, so modern testing does create trace amounts of medication that can occur. I will tell you that the peer-reviewed articles are having an impact. I've sat on a couple of HISA committees and they do talk about the peer-reviewed articles. A lay article, as much as I would love it, is not registering with them. We have to continue to get the peer-reviewed articles out, in my opinion, to help you all. Okay? Lastly, modern testing. Picograms are very, very minor amounts. If you do get a chemical identification, I don't want any trainer or any groom or anybody say the word positive. Switch the language that's helpful, because it also helps them with the heart of the horse, because the word positive is a negative word. Say chemical identification, that allows you more freedom to go where you're going to go. Irrelevant levels do not affect the race. That is the hardest thing to get certain regulators to understand. But that's why we're spending all our time getting the peer-reviewed articles. And just be careful. This is a testing barn that was sent out from ARCI, their own documentation. I love it. There's not a glove anywhere. Okay? So it's not that we can't educate ourselves, that we're going to have to slowly but surely work our way toward it. Okay? And my hope is, with the peer-reviewed articles and other things, and these scientists that are all doing really well, we can slowly get it to where people will start to listen, and there'll be less and less, and though these environmental things won't affect the overall image of racing. That's the hope. Thank you all very much.
Does anybody have any questions?
Real quick, what about, when you get LASIX, none of the vets wear gloves when they're giving it?
Yeah, that's bad.
That's
I'm a
bad.
diabetic. I gave my horse a shot, it'd have metformin in him.
They, yeah, that's bad. And they have come right out and said, so there was a case in Ohio, with a methamphetamine, and the actual expert for HIWU said, well, the vets wear gloves, so that can't be where it came from. I don't know. The expert for HIWU had never been to a racetrack apparently, but, I mean, that's what he said. And then Lisa Lazarus made the comment at one point that it interferes with the dexterity of the veterinarians to wear gloves, and therefore it is not in the best interest of the welfare of the animal for them to wear gloves. And I immediately went to my equine surgeon and said, don't you think it would be better for the health and welfare of the horse if you didn't wear gloves during colic surgery? Because doesn't it affect your dexterity? That's what Lisa Lazarus says. So they thought probably that's not true, just for what it's worth. But yeah, that is definitely a real issue. There's no question in any of our minds that the vet responsible for getting blood on, we had 3 or 4 metformins in Indiana. We're pretty sure the vet was taking metformin, but HIPAA couldn't ask that question. But yeah, that's a real problem. No question about it.
So definitely document that. If you see a veterinarian that's not wearing gloves, I would take a picture. I would write it down somewhere. I would ask them, I would be a pain about it. I would ask them to put on gloves, and I would ask that they write in their documentation that they were not wearing gloves.
HIWU does specifically
say you can't.
ban
Pictures.
us taking any pictures of them.
Pictures or video.
Whether it's in the test barn, whether they're out of competition testing, whether they're shaking down
say
your
that.
barn.
I would definitely write it down in some form so you remember that.
And I want to recap that, you know, we're mostly doing these research papers not paid. And I'm not asking you to pay us, but what I am asking you to do is support the research, because it costs us $2,500 to $3,500 per paper to get it published. And that's if we're not doing a lot of like lab testing and actual research, animal research. If we're doing that, then it's going to cost us a little bit more. So, you know, again, whenever you have a board meeting, throw us in there. You know, we still need support.
I've never really looked at but how about assistant starters? Have they ever been looked at as far as whether they're wearing gloves and?
So it's a very good question. In that one picture, it was just the tongue tie had slipped off going up to the gate, you know, and the pony horse people. And by the way, I help the pony horse people all the time, and I'm always scared to death when I have to put a pony horse on a drug. I'm like, do we have to do this right now, right before those big races? But to your point, yes, it can be anybody at the gate. And surprisingly, the data on methamphetamine, which was Heather Kanish's work, showed that it's like 5 to 10 minutes after you've gotten it contact of their mouth, it's showing up in their system. So
Not
it's
even that
very
long.
fast.
It's not even that long. So,
Yes.
so to your question specifically, there was a series of methamphetamines at Lone Star Park that was maybe 10 years ago. And they were pretty convincingly traced to the assistant starters.
That- That's right.
They shook them down. One guy has a mug shot. I have the picture of it somewhere for for an article. It might even be a Horseman's Journal article. And then Clark Brewster was the attorney for a couple of the horsemen, and he was able to get them all dropped. However, the horses were still disqualified, which is unfortunate. And then one of the guys, because I was trying to figure out if there was any overlap between. So one of the guys went from being an assistant starter at Lone Star, went to Canterbury, where we had 3 methamphetamines. And then he went from there, he actually went to Arkansas, which we haven't had any in Arkansas that I know of. But the point being is that they just quit or they walk out. The assistant starters at Canterbury were asked to be drug tested, and they all quit rather than be drug tested. And then obviously the one guy did go to Arkansas, because I just followed his name and he went to Arkansas, but we didn't have any positives from Arkansas, so maybe he learned how to wash his hands after that.
So nothing against assistant starters, but the way they're great, folks and
Yeah.
all that. That's just thought about that because
I will say this to that point, back in the day when we were running around, they'd test us all on the back of the gate. They would make us go and catch. And I remember the stewards would call down and go, we're going to do everybody on the starting gate. And I was like, well, I'm a veterinarian. I'm standing behind this gate too. Let's go. So we'd all go. And it was, you'd find people 2 weeks later, they were gone. You never found out what it was, but something was going on. HISA, when I sit on these committees, I get the impression that they're trying. At the same time, do I think it's moving fast enough? Probably not, but I'm hoping that in time it might get better. It could get worse before it gets better. That's why we're trying to protect you all.
Hi, good afternoon. Thank you for
think that's-
sharing your panel with us today. I'd just like to know if we wanted to make a donation, do we send it to the National HBPA and make it restricted funds for the panel? Do we send it to NARV? Do we send it to Gluck?
The best place to send it is the Equine Health and Welfare Alliance, and I'll get Eric to send out an email to everyone.
We're
with
going to
that
keep doing
information.
the peer-reviewed articles. Dr. Finger and Dr. Brewer and Dr. Tobin are working endlessly. And every time we trip across these things, we're doing it. And I am faithful to Kentucky, but I'm also faithful to Charlestown because that's where I got my start.
And
So West Virginia is near and dear to me.
if you, I mean, obviously, we encourage everyone, and most everybody does, but we encourage everyone to contact one of us when you get a positive test and you're trying to help the horsemen, because we get, the way that we got the levels on a lot of these research papers was because of you guys.
That's right.
So like I got Mike Lauer's report. So that's how I knew what his level was. Through the NARV veterinarians, a lot of people do share their information with their own veterinarians. And so those veterinarians then reach out to me and then I get that information. So that's how we're getting it, because they're not publishing it. So just reach out to us. And then if you have something where you are just absolutely certain that this guy did not do it, then, we that can potentially be the next source of a article for us, a publication, so that we can try to sort it out. And some of the forensic investigation is of course Dr. Brewer's specialty, but some of this forensic investigation has been, I mean, I hate to say kind of fun because it's on your all's backs, right? But kind of fun because it's like, who knew? These are the kind of investigations that HIWU should be doing. These are the kind of investigations that the FEI is doing. It's part of their response to an atypical finding. And instead of Highwoo actually doing an investigation, they put it all on the Horseman, which ends up being, at least in part, sometimes it ends up being us. So and it's kind of what led to this water study that we're doing. And, you know, we've done some stall swabbing studies that we'd like to continue doing. So there's, you know, that is that is where we get the idea for these papers. It's from you guys.
Well, thank you again. If I can give one more hand to the panel, we appreciate that information.